Do females suffer from arthritis more than males? Hi, I am Dr Kunal Shah, orthopaedic and joint replacement surgeon at Ashutosh Hospital, Vadodara. This is a common question that a lot of people ask me. Yes, this is true. The incidence of arthritis in females is more than in males. Why is this so? There are multiple reasons associated with it. The first reason is the volume of articular cartilage in females is lesser than in males. Articular cartilage is the cushion that protects your joint. When the articular cartilage is less, it means lesser protection for your joint. Secondly, estrogen has a protective anti-inflammatory action on all your joints. So after menopause, after the age of 45 to 50, the level of estrogens decreases and this decreases the protection of your joints. Thirdly, you would have noticed that all the gymnasts are mostly females. You know why? Because the laxity of female joints is much more than males. Now, this laxity makes it more prone to injuries. These micro injuries over a period of time can lead to arthritis. Lastly, it has also been observed that there is a genetic linkage with the female sex. This means that arthritis can be transmitted from the mother to the daughter. Now, all these are not things that are under your control. However, there are two things that you can definitely do. One is to maintain a healthy weight. Obesity puts more stress on your bones and ligaments, and as a result, it can accelerate arthritis. The second thing that you can do is do regular exercise. Exercise improves the strength of your muscles and ligaments and improves joint stability. As a result, you are less prone to injuries. I hope this information was useful and it will help you take better care of your joints. Do share it with your friends and family too.